Amy Huebschmann. I'm excited to talk to you today about my role at Accords and the value that I think Accords brings to our campus community as it relates to clinical research. A little bit about me. I'm an associate professor in the Division of General Internal Medicine in the Department of Medicine here at the University of Colorado Anschutz Medical Campus. I also am the lead scientist for community education and outreach with the Center for Women's Health Research here at the Anschutz Medical Campus. My roles here at Accords include leading implementation science research aspects of projects and also helping to develop the next generation of implementation science researchers. Thinking about the research areas that are my passions, I'm really excited about the potential of implementation science to bring evidence-based programs into the real world. This is really why I live, breathe, and eat implementation sciences, so that we can take the amazing promise that we have in programs that have been shown to be effective and make sure that they really can see the light of day, that they can be actualized into real-world primary care or real-world community settings. Just to give one example of that, a study I recently completed was looking at how we help patients with type 2 diabetes who have poor control of their blood sugars to improve their care. And we looked at how to leverage apps, mobile health apps that track glucose and share it back and forth to clinical teams to improve the care of diabetes. It was really exciting, some of the things we found that really it would be important for this work to go forward and be scaled out further, that the program would fit the clinical side's need, the clinical team's needs, by making sure that there's a point person who's more of a technician, a tech who can help bring in the mobile health data from the patients, get it into the chart. And in our project, the research assistant served that role, but for this to actually take place in the real world, those techs need to exist. And actually, University of Colorado Health Program now has a virtual diabetes home and remote care program that I'm part of, where they're doing that, where we have technicians who their purpose is to make sure that the data flow back and forth from patients to clinical teams. I think that's going to be a really exciting area for healthcare going forward, is how do we really make use of the data revolution that's happened and how much data patients can share with clinical teams. In terms of a success story for Accords, I'm the founding director of the Accords Dissemination and Implementation Science Graduate Certificate Program. We kicked off in 2019 with our first students, and we have just now here in 2021 enrolled the next set of 12 students who will be beginning the program. It's been a success story because it's grown so quickly, and we've attracted a national and even an international audience of students. There have been students from Canada and all across the United States who've applied to participate in our program. So this shows, I think, there's a real need to train people in implementation science, and the fact that Accords would sponsor this program along with the CCTSI on our campus to support launching it and continuing it was really pivotal. If we wouldn't have had that support from Accords, we couldn't have developed this program, we couldn't sustain the program. So it's really meeting a need for training in implementation science locally on our campus and for others nationally and internationally. I just also want to talk about how I discovered and started working with Accords. Really, I've been working with Accords for my entire research career. There was a primary care research fellowship that Accords led for many years, and I was part of that from 2006 to 2009. So I was able to be trained in health outcomes research methods during that program. That helped me to compete for a K Award, a Career Development Award, and develop my research credentials further, including further formal training in implementation science. And now I'm excited to be part of Accords' efforts to collaborate and build capacity for doing translational research on our campus by serving as an implementation science research investigator on other programs. For example, our colleagues Stan Zeffler and Lisa Sacudo have a U Award from NHLBI, and I'm the lead implementation scientist on that grant. To sum up, thank you for listening, and I hope I've explained some of the value of Accords. I think really, in a nutshell, what Accords does is it allows for great collaboration and team science, helps our campus divisions that tend to be siloed to bring those together and to cut across divisions that researchers in different areas of the campus may otherwise have. And Accords also does an amazing job at capacity building and training researchers in different areas. And those are the key things that I think Accords brings in terms of value. Thank you for listening.